So the next thing we're going to talk about are the risks. And notice I have my cheat sheet this time because I want to make sure to cover all of the important risks. So risk number one is failure of an implant. Implants fail. That's just the bottom line. So nationally, the best implant placed by the best provider in the best patient in the best bone, we can have up to a 3% failure rate. So are there things we can do that will increase the failure rate? The answer is yes. It's all about your health history. So the number one thing that increases implant failure rate is a history or current smoking, right? So I'm going to explain this an easy concept, easy way to understand. When I do teeth extractions, my smoking patients are sometimes my favorite because when I make an incision or I take out the tooth, there's a limited amount of bleeding. So when we're smoking, it decreases blood flow in our mouth. When we're talking about healing from an implant, what do we need? Increased blood flow. So coincidentally, smoking patients have a much higher failure rate of implants. What's another thing that can increase failure rates is diabetes. So if you have poorly or uncontrolled diabetes, you're going to have delayed healing and again, a much higher risk of implant failure. If you're diabetic and smoking, frankly, I won't even do your case because the implants are most likely going to fail. So keep in mind that your current health situation might have a big impact on the likelihood that you're going to have an implant failure. Another risk is a broken bridge. We've talked about this in another video, but bridges can break. They can break from lots of things. They can break from trauma. They can break from just normal chewing, maybe biting on something you shouldn't have. Heaven forbid you do what one patient did and try to open a beer bottle with your new fake teeth. So you totally can break a bridge. That's a risk. A broken implant. Yeah, can implants break? The answer is yes. Again, caused by the things we've already talked about. We can have soft tissue risks, meaning we're doing the best we can to control the soft tissue. However, maybe it doesn't heal naturally in one place, or we need to go back in and do some soft tissue grafts in the future. That can be a risk. There's also another big risk if you're being sedated. There's a lot of risks that come along with sedation. So that's why it's important to talk to your sedation provider ahead of time, go over those risks, but those risks can be extensive. In fact, I don't know of any sedation provider that will tell you that the risk of death is not a risk. That can be a risk. So these are important things to discuss with your doctor and with your sedation provider. So it doesn't matter which option you're going with, they all have risks because it's associated with implants. So let me make sure my cheat sheet doesn't have anything else that I forgot about. I don't think so. Oh, when it comes to your health, another thing to make sure you go over when you are talking to your doctor is a full evaluation of your airway, your heart, lungs, current medications, and of course, habits and lifestyle. So those are the important things to consider when it comes to risks.